Epidemiology question bank. MCQs 1. A researcher identifies 300 patients with ischemic stroke and 300 healthy controls. Both groups are interviewed regarding their history of hypertension over the past 15 years. The study design is A. Cross-sectional study, B. Cohort study, C. Case control study, D. Randomized control trial, E. Ecological study. So it is basically case control study. Explanation. The study starts with disease, stroke versus healthy controls, and then look backward to determine exposure, hypertension. This is the hallmark of a case control study. Why others are incorrect? A. Cross-sectional measures exposure and a disease at the same time. B. Cohort starts with exposure, not the disease. D. Randomized control involves the random assignment of treatment. E. Ecological studies compare populations, not individuals. MCQs 2. A cohort of 8,000 smokers and 8,000 non-smokers is followed for 20 years to determine the incidence of lung cancer. This was the cohort study in which the incidence was determined. Which measures of association is most appropriate? A. Odds ratio, B. Relative risk, C. Prevalence ratio, D. Sensitivity, E. Specificity. So for cohort study, we will consider it as relative risk. B. A cohort study classifies the participants by exposure and followed them over time. Since incidence can be measured, relative risk is the preferred measure. In cohort study, we measure relative risk plus incidence. So the incidence can be measured, and now relative risk will be preferred. MCQs 3. A survey assessed obesity and diabetes among 5,000 adults during a single health camp. So this was a study about the disease, an informational study. So, and at the single time, the study is best described as A. Cohort, B. Cross-sectional, C. Case control study, D. Case series, E. Clinical trial. So it was cross-sectional study. Both exposure and disease measure at one point in time, providing a snapshot of population. Example, cross-section studies measures the prevalence, not the incidence. Which study design is most suitable for investigation rare disease? So A. Cohort study, B. Case control study, C. Cross-sectional study, D. Randomized control trial, E. Ecological study. So for the rare disease, we will consider case control study, I think. Yes, it is case control study. Explanation. Rare diseases are difficult to study prospectively because they occur infrequently. Case control studies efficiently begin with the affected individuals. Memory trick. Rare disease is equal to case control. A physician reports the first case of severe liver failure associated with a newly introduced medication. This represents A. Case report, B. Case series, C. Cross-sectional study, D. Cohort study, E. Ecological study. As a first case report, it will represent the first case report A. A case report describes one usual patient or event and is useful for generating new hypotheses. MCQ 6. Which epidemiological study provides the highest level of evidence for determining whether a new antibiotic is superior to the current standard treatment? So A. Cohort study, B. Case control study, C. Randomized control trial, D. Cross-sectional study, E. Ecological study. So it is C, randomized controls trial. MCQ 7. Loss to follow up is major limitation of A. Cross-sectional studies, B. Case reports, C. Cohort study, D. Case control study, E. Ecological study. So it is, I think, cross-sectional studies. Oh, sorry, it is C. Cohort studies. Participants in the cohort studies are followed for months or years. Some participants may drop out, introducing the attrition bias. 8. Which study design is primarily measure the prevalence? A. Cohort study, B. Cross-sectional study, C. Case control study, D. Randomized control trial, E. Case series. So prevalence is measured by cross-sectional study. Prevalence is the proportion of a population with a disease at specific point in time, which is main purpose of cross-sectional study. Researchers compares the estimate between two cities with different levels of air pollution using city level data rather than individual patient data. This is example of ecological study. A. Ecological study, B. Cohort study, C. Case control study, D. Randomized control trial, E. Case series. So it is ecological study. Ecological studies analyze the groups or population, not individual. A common limitation is the ecological fallacy, where the group level findings are not applied to individuals. MCQs 10. Recall bias is most commonly associated with which study design? A. Cohort study, B. Case control study, C. Case cross-sectional study, D. Randomized control trial, E. Case series. So recall bias is most commonly associated with recall bias. I think it may be with the case control study. Yes, right. Patient with a disease cases often remember past